Now we'll discuss tooth number 26 upper left molar prep. In many cases, the posture for the molar area is similar to that for the premolar area. However, for molars, visibility attainment and instrument accessibility attainment require more finesse than for premolars. This means you need more posture micro-adjustment and more active use of mirror retraction. Mirror retraction becomes significantly more crucial in this area. Consequently, a grasping mode combined with parallel alignment offers little to no benefit when performing a molar prep. So, we'll bypass the grasping mode entirely and proceed to the suction hooking mode, maintaining parallel alignment. Now for the occlusal prep of tooth number 26, using the suction hooking mode in parallel alignment. With the patient's head gently rotated to the right, the suction is then hooked into the oral cavity on the right side. In this specific suction hooking mode, should the patient remain facing directly forward, applying merely a subtle rotation to either the left or the right side will cause the water to naturally follow the pull of gravity and flow in that particular direction. Therefore, even if you turn the patient head position only slightly in the direction of the suction, without doing too much, it is sufficient for suctioning. Returning to posture, the operator body orientation is at about the 10 o'clock position, staying close to the head to help with visibility attainment for the occlusal of tooth number 26. With my left hand, I'll use mirror retraction to slightly pull back the left corner of the mouth that is blocking visibility attainment of the target area. I want to emphasize again that this retraction should be minimal, only as much as needed for visibility attainment, and there's no need to do it excessively. With my right hand, for visibility attainment, I'll hold the handpiece with a longer grip and initially place my fourth and fifth fingers as a rest. To compensate for the imperfection of the right hand long grip, there's also a technique where you support the handpiece neck with the second finger of your left hand. Let's examine it in the video. Like this. You can also grasp the handpiece within your palm, establishing a firm rest on the tooth with your initial finger and subsequently using your second finger to provide additional support to the handpiece head. As I've said before, the posture for the molar area is similar to that for the premolar area and can be seen as an extension of it. However, since the target area is located deeper, you'll need to fine-tune your visibility attainment and retraction with more precision and detail. This ensures that you can effectively prep the target area with the absolute minimum amount of visibility and retraction necessary. Next, we'll see how to prep the occlusal area from the palatal aspect. This differs from the previous slide, as I'm using a short grip on the handpiece with my fourth and fifth fingers resting on the premolars. All other posture elements remain the same. One of the differences between the molar and premolar regions is that mirror retraction is required more actively. For mirror retraction, it's healthier to perform it intermittently with the least amount of force, ensuring just enough distance for sufficient visibility attainment. Prolonged static retraction, exerted with excessive force against the patient's soft tissue tension and extending beyond what is strictly necessary, can detrimentally affect your health by straining the control muscles in your fingers, wrist, and the upper left area of your back. Let's watch the video again, specifically focusing on the prep of the occlusal from both the palatal and buccal aspects of tooth number 16. What I want to emphasize in this slide is how the left hand provides auxiliary support to the handpiece head for both the palatal and buccal aspects, demonstrated in various ways. I want to emphasize that you can create this auxiliary support in creative ways for various situations. When doing anterior prep, my left hand, specifically my index and middle fingers, was often used to manipulate the obtrugate wing to prevent water from splashing. However, for posterior teeth, water splashing is not a concern, and since the target area is located deep within the oral cavity, greater emphasis is placed on this auxiliary support, which adds stability to the handpiece's movement. Let's make a comparison. In the image on the left, the mirror is grasped deep within the palm, specifically between the first and second fingers. The ring finger obtains a hard rest on the tooth, and the fourth and fifth fingers get a soft rest on the zygoma. The stability gained from that rest is then transferred by this finger to the head of the handpiece, providing supplementary auxiliary support. If you look at the photo on the right, the fourth finger of the left hand is resting on the zygoma, and the middle finger provides auxiliary support to the handpiece head. Now, let's examine tooth number 26's palatal aspect. The patient's head is forward, and the doctor's position is aligned nearly parallel to the 10 o'clock. For the operator's neck, there will be a slight right lateral flexion. This is to ensure the line of sight is aligned parallel to the tooth's axis, maintaining proper visual alignment. The left hand handles mirror retraction, and the right hand rests the fourth and fifth fingers on the masseter. Suction is on the right side. What you're seeing on the screen now is the view from an action camera in the molar region. Even though it might look like the occlusal or palatal surface of the molar is blocked by the patient's lower jaw, making it appear that the target area isn't clearly visible, I assure you that the operator's actual line of sight has perfectly sufficient visibility attainment. Let's look at number 26's palatal and interproximal. When targeting the occlusal, the patient's head rotates slightly more to the left compared to other areas. This is to facilitate visibility attainment of the adjacent interproximal surface. Specifically, for the distal area, the degree of visibility attainment quite significantly depends on whether the patient's head is moved slightly to the left or not. The operator's neck will exhibit substantial forward flexion. In order to achieve parallel alignment of the molar's occlusal surface, the posture inherently necessitates forward flexion to ensure proper visibility attainment. This is especially needed when prepping the maxilla and distal interproximal surface. It's not an ideal posture. There are a few alternatives to reduce this forward flexion of the neck. The initial approach involves utilizing an indirect view with a mirror, while the subsequent method focuses on employing perpendicular alignment. The third is to tilt the patient's headrest back as far as possible to create an angle, and the fourth is to appropriately set the distance between the operator's body and the patient's head, whether closer or farther, to fit the situation. During palatal prep, it's essential to hold the handpiece with a long grip. This allows you to position the rest on the right masseter muscle, ensuring your hand doesn't obstruct your view of the oral cavity. The difference in fine motor control from the long handpiece grip is compensated by supporting the part of the handpiece near the head with the fingers of the left hand. Alright, now let's take a look at the prep stroke together with auxiliary support. This is how you go about incorporating more stability into your technique. Let's review the handpiece grip and auxiliary support with a still image. By using a long grip on the handpiece, you achieve clear visibility of the oral orifice. The instability that arises from this long grip is resolved by providing auxiliary support to the handpiece neck using the second finger of the left hand. Let's examine the prep for tooth number 26's buccal and interproximal surfaces. The patient's head is rotated right and the operator's body is at 1 o'clock in parallel alignment. The operator's neck will naturally have some forward flexion, so it's important to take breaks and rest your posture periodically. The left hand is responsible for mirror retraction, and the fourth finger of the right hand rests on the anterior teeth. Suction is hooked at the right corner of the mouth. In this video, you'll observe that the operator initially positions their body at the 10 o'clock setting. However, upon recognizing the disadvantage this presents for optimal visibility attainment and parallel alignment, they subsequently shift to the 1 o'clock position. This highlights the importance of having the expertise to be aware of various selectable posture elements related to each target area, to precisely perceive the comfort and discomfort of one's own body, and to flexibly adjust these posture elements according to the situation at hand. Alright, today we've gone over the posture elements for various target areas on the tooth number 26 upper left molar, specifically focusing on parallel alignment with the suction hooked. Thank you for your kind attention.